Hi everyone, my name is Grace. Today we're going to be talking about HIV. HIV is a global health issue, and we know that in 2023, we have 39.9 million of people living with HIV. Among them, we have 1.3 million new infections and a 630,000 of deaths. Based on CDC data, we can see that 37% of 31,800 individuals are black individuals who got the HIV in 2022. Since our study is gonna be focusing in Africa, we're gonna be using all data that report that 25.6 million of people were living with HIV in Africa in 2021. Also in South Africa, we have found that HIV prevalence was estimated at 30.2%, and among this prevalence, we have 33.9% was gay, identified men, and 6.9% among those bisexual, all men, and 10.1% was men who got sex with men. This population faces different barriers. Our problem statement: barriers to accessing and using its prevention services among men of color who have sex with men in South Africa contribute to the prevalence and the high rate of the new HIV infection. Contributing factor. Between the contributing factor, we had the social, economical, and education factor. Both of them, they are associated with each other. Without the education, they cannot know how to prevent themselves, which type of healthcare services or preventive services they need, and also is they find their income. Since their income is low, also they cannot pay the copay if of which the insurance require, or sometimes they don't have insurance. So that is the relationship principally between social, economical, and educational factor. Also, living in lower income community, they don't have access to healthcare services, so they have to pay for their transportation and all those stuff. Adding on to this factor, we have the stigma and discrimination, and they live that stigma and discrimination by the family member, healthcare provider, and peers. Considering this environment, septic environment, and they discourage those individuals to seek for testing and treatment or preventive services. That is why our intervention led to address HIV stigma. Also, considering that you the target is have to a 1990 and has is their goal, but stigma so around HIV is the barrier to reach that goal. Our intervention got 3 steps. The first one is to create the captive image with a question, and we're gonna be distributing this graphic in billboards, print media, and online advertising, where they can start discussing. When they see the image, they see the question, they can start discussing about the topic, and is to increase awareness and self-evaluation. The second stage is to create the promotional materials. And to know what we're going to put in that promotional materials, we need to realize focus those intervention with the community members and insert the governmental representation. We have to include the governmental representation and researchers too. Third is going to be to create the website. Creating the website, we're going to identify, we're going to put important information in those websites, and also the tutors will be on that website so they can create a safety space for those individuals to share their experiences and discuss issues related to stigma. Our sustainable development goal is the goal 3, which is good health and well-being, which aims to ensure healthy life and promote well-being for all individuals at all age. Cultural consideration. Cultural consideration, stigma is a sensible topic. That is why it's important to understand the diverse beliefs around sexuality, health, and morality in different cultures. So by knowing that, we can easily address the issue. The second, we have to understand the misconception around HIV in that community have to be addressed. The myth around on third, because we're gonna be working in different communities, principally in Africa, where we have different languages, is we have the campaign message have to be in different languages, as well as the educational materials where everybody, even the person with low literacy can have access and understand the message we are sharing. The last one, we have to engage with the community leaders, where engaging with the community leaders and influence is vital to build trust and acceptance. The interprofessional team we're gonna be working with is the health communication specialist, which we're gonna be responsible to create all those graphs. Sharing through the media is very essential if we want that our information or our graphics stimulate a conversation about HIV stigma. Third, the community health worker gonna be the one sending those educational materials close up to the community or the person more identified like they need it. The public health educators too is essential because we're gonna be one creating all of these educational materials. They're gonna be the one gonna realize the focus group, identifying the topic they're gonna be talking in those educational materials. Third, they're gonna be the one training our healthcare providers and the community leaders. Also, all of these steps need funding. That is why one of our partners gonna be global funding for fighting AIDS, tuberculosis, and malaria. This organization have to gonna help us with the funding, and is gonna ensure that our campaign gonna be in long term. UNAIDS is the one and we are supporting by this intervention. So they're gonna help us disseminating our campaign materials through their network, as well as they're gonna support us. So technological support resources, since we can use their feedback to evaluate the progress of our intervention. Also, we're gonna need the South African nation aid consulting, since they know already the community, they work up with HIV people, so they have already their own program. We're gonna use their network. Our intervention can be called can be cultural appropriate for our community. Evaluating, we're gonna be asking two questions. The stigma is reducing or increasing? Indeed, health care services use is increasing, principally among men, men of color who have sex with men. And we're gonna be realizing survey, focus group interview to evaluate our intervention. We wish that this presentation, anybody who can listen to this presentation can be influenced and in two ways, personal and professional value can change. Principally, it can increase their awareness about the topic, and they can engage the topic with more empathy, sensibility. On the professional level, we wish that they can advocate for our target population, creating policy which allow more equitable access to healthcare services for them. Thank you. Additionally to this presentation, I add the abstract here. You can pause the video and read it, and we have the review. Also, I'm so thankful for my teacher, and thanks for everything we learned during this course. Thank you. Bye.